with Ellen Meyer of Lonza. Ellen, thank you very much for joining us today.
My pleasure.
I want to talk to you a little bit about the Model Aquatic Health Code. Now, this is to ensure public health in recreational waters. What kinds of activities have been going on there?
Yeah, CDC a long time ago looked and saw that the state regulations were all over the place, and so they went to state regulators and they said, would you like to have a model code that you can use as a standard? And they all said yes, we would love to have a standard. And so that was produced then. The first edition came out in 2014, and since then we've been updating it every couple years to make sure that it's current with current public health ideas and with new technology for public health. And so it's good to have a standard that is across the United States that people can understand, and it's in two parts. So it has the code that has the shall language, and then also has another part that has the justification for those values. So you shall have your pH between 7.2 and 7.8, and then the annex says why. And so that's good for public health regulators then. So when they want to change their own codes, they can make those changes a lot more easily.
Interesting. Now, cyanuric acid in particular, this has been in the news a lot, and I know that the MAC is they're lowering their limits, and there are some states even that are saying that you can't use it. Why? I mean, what's the issue there?
Yeah, there have been concerns with cyanuric acid for decades because it slows down chlorine's reaction rate with bacteria, viruses, and other pathogens. So if you're slowing down the activity of chlorine, then you're increasing the risk then for disease transmission in a pool. Mm-hmm. And so there's been concerns for years, but it's really hard to draw a line in the sand and say this is too much, this is too much risk. And so CDC has recently started a committee. They call it the Ad Hoc Committee for Cyanuric Acid, and I'm on that committee, and we've been talking about taking all this data that's been around for decades and showing, okay, then this is how much more risk that you could have. CDC has generated data recently with cryptosporidium where they showed that they never really got good enough crypto kill rates, even with 20 to 40 parts per million of chlorine in the water. So there's a definite need to look at this whole issue and to try to figure out, okay, how much risk is too much risk.
Right. So what are some options then? I mean, if people are trying to kind of steer away from cyanuric acid, what can they do?
Well, cyanuric acid is really the only stabilizer that we have that's commonly used in the market for stabilizing chlorine. But if you have an indoor pool, then you don't need any cyanuric acid, so that's an option, is to not use any cyanuric acid. And there's different sanitizers you can use. Stabilized sanitizers, every time you put the sanitizer in the water, you're putting cyanuric acid in the water. And so there's other sanitizers where they're not stabilized, like calcium hypochlorite and sodium hypochlorite bleach. And so you can add these separate from your cyanuric acid so you can stay in control of your concentration of cyanuric acid. So it's good to stay in control and just add it as needed rather than always be adding it without any control over it. And in hotels and motels and smaller facilities like that, a lot of times they like the slow dissolve characteristics of trichlor, which is a stabilized sanitizer. And we have a new product out that is non-stabilized cal hypo that's a slow dissolve tablet. So now you can have that ease of use and not be contributing to cyanuric acid. So it's good that for indoor pool facilities or places that you need to stay in control of your cyanuric acid, you can use a slow dissolve cal hypo tablet.
Now, are there some best practices maybe that you could share?
Sure, yeah. Just like I said, for indoor pool, you don't need any cyanuric acid, so it's better not to have any because you want your chlorine to be as active as possible because you don't want any disease transmission from in your pool. And so it's important to make sure it's as active as possible, so just don't use any cyanuric acid. And then for outdoor pools, to stay in control of it, using a non-stabilized sanitizer. And then the level, that maximum level, if you want to be able to follow the fecal contamination response that CDC has recommended, then you need to keep it below 15 parts per million, or you're going to have to drain your pool anyway to get it down to 15 parts per million before you can do your remediation procedure.
Well, Ellen, thank you so much for joining us today. We really appreciate it, and wish you all the best of luck in your research in this area.
Thank you very much. Appreciate it.